What is structural racism in Black health equity? Have you ever wondered how the systems around us shape our health? Today, we are talking about structural racism and its impact on health equity for Black communities. Structural racism is not just about individual actions. It is about how laws, policies, and practices are set up to create and keep racial inequalities. This means that Black communities often face challenges that white populations do not, especially when it comes to health. At the heart of structural racism is access to essential resources. These include safe housing, quality education, job opportunities, and healthcare services. These resources directly affect what we call the social determinants of health. These determinants define the conditions where people are born, grow, live, work, and age. For many Black individuals, these conditions are often less favorable. This leads to higher rates of chronic diseases like hypertension and diabetes, along with poorer mental health outcomes. For instance, healthcare systems influenced by structural racism may offer lower quality care to Black patients, even when they have similar income and insurance as white patients. This can mean less access to effective treatments, delayed diagnoses, and inadequate management of health conditions. Nursing homes that serve mainly Black residents often have fewer resources and lower staffing levels, resulting in poorer care quality. Additionally, barriers like needing photo identification for medical services can further restrict access to care for Black individuals. Structural racism also affects health behaviors and preventive care. Limited access to healthcare providers who understand and respect Black culture can reduce trust in medical advice. Nutrition is impacted by food deserts and economic limitations, making it harder for Black families to find healthy food options. However, there are culturally relevant alternatives, such as modified soul food recipes, that can help improve nutrition. Mental health issues can arise from the stress of experiencing racism and from a lack of mental health services that address cultural needs. Fitness opportunities may be limited by safety concerns in neighborhoods and a lack of community resources. To tackle structural racism in Black health equity, we need to reform the policies and systems that create these inequalities. This means promoting healthcare that is culturally competent and respects Black cultural contexts. Implementing preventive health strategies that consider social realities is essential. We also need to improve the management of chronic diseases while paying attention to racial disparities. Supporting mental health services designed for Black communities and encouraging accessible fitness programs is vital. In essence, structural racism is a key factor behind many health disparities in Black communities. It operates through interconnected social, economic, and institutional mechanisms that limit access to resources and quality care. To achieve health equity, we must confront and dismantle these barriers, creating conditions where Black individuals can achieve optimal health and well-being.